Staying in the question. What is it all about? Well, staying in the question is a way that I have of thinking about and talking about being in relationships with patients. And it has to do with not making any assumptions that I know what it is they're talking about when they ask me a question. I think my clinical training has me go very quickly to wanting to give them answers. And what I've learned is that sometimes I'm giving an answer to a question that hasn't been asked. So staying in the question is about an attitude of curiosity, a belief that there's more to learn, more to understand, as well as the skill of listening, of really paying attention and following the patient and not just going off in another direction than the one they've taken me in. And an example of my recollection of that historically was when I remember working in a practice when a patient was asking a question. She was going to have a crown for the first time. And she was asking a question about, she said, what's the difference between a crown and a filling? And we gave her a wonderful explanation of how exactly a crown is different from a filling, with a great deal of technical expertise and quite frankly in language that she could understand. But it had to do with one building structure into the tooth and actually preventing further breakdown and going out to a laboratory and margins and that sort of thing. And I noticed at some point that her eyes were glazing over and she was sort of nodding and smiling politely. And I said to her, "Are we answering your question?" And she said, "Well, yeah, sort of. Will it hurt?" And I realized that we were doing a great job of answering a question. It just wasn't the question she was asking. And so experiences like that have taught me that if I can ask one or two more questions, I can better understand what it is they want to know, and I can answer more appropriately. So for example, now if a patient says, "What's the difference between a crown and a filling?" I might respond by saying, "That's something I'd be happy to talk with you about. What would you like to know about the difference between a crown and a filling?" And I very often get a little bit more information that allows me to give a much more accurate representation of really what is the difference between a crown and a filling.